One major challenge faced by the people of Ombokaha is having access to quality health care. Residents of this twin community have to either walk or transport persons who need medical care on motorbikes, tricycles, or cars to probably the nearest health facility at Kaleo, which is several kilometers away from their community. A community-based health planning and services CHIPS compound that was started several years ago had its construction stalled, bent on having medical care at their doorstep, and as a stopgap measure, a school block that was constructed for the education of their children was further converted into a clinic to provide primary health care services for the people. They also provided free accommodation to the nurses working at the mixed structure until the CHIPS compound was completed and handed over to them. The Nadowli-Kaleo District Assembly, led by its Chief Executive, Catherine Thierry Lankono, concerned about the plight of the people, came to their rescue and completed this construction together with another Asamatugu who are also facing similar challenges.
I met about 7 old projects that I have worked on, just about the last batch 1. So we've worked on all. This is a health facility that is very dear to the hearts of the people because of where they are located. There is a distance to the Kaleo health centers and also a distance to Tebane or Jang. So it is very paramount. It's covering 2 communities, Ombo and Kaha, and for that matter, the population is huge and they deserve a health post. Right now, I think we are reducing the traveling distances for healthcare, but due to the population increases, we are further reducing it so that we don't have a longer distance and waiting period at our health centers. So, for instance, the Samatigu, they were benefiting from Sankana Health Center, but because of the population increase, we have decided to give them their own health center. So we are still going on and on. We'll make sure that health and education, which are very paramount to my administration and the administration of the MPP government, we are going to continue to bring it to the doorsteps of the people.
Nadowli-Kaleo District Director of Health Services, Phoebe Balagunyantimi, was grateful to the Assembly for handing over the CHIPS compounds to the communities, which he said will aid in disease prevention and promotion.
So now having a structure like this is going to enable the healthcare providers to now move into a bigger space and have a more, convenient environment or congenial environment to provide services. So in terms of healthcare, our worry as we speak now has to do with access to maternal and child health services, disease prevention, and this is about disease prevention and promotion, because now we are seeing a lot of what we call the non-communicable diseases. And I must also say that for my district, we are beginning to record a lot of cancer cases. So once we start primary health care, we do health promotion, prevention of diseases, I think we will be getting somewhere than waiting for the conditions to come and then we'll work on them.
Phoebe Balagunyantimi also spoke about the rise in perinatal deaths in the district, calling for support from the Assembly to tackle it.
If you look at perinatal deaths for the first half, we have more than 20. And that is alarming. That is alarming. That is alarming. And that is deaths from 28 weeks of pregnancy to delivery. You get it? That is a problem. A lot of the babies are dying. So we will sit down to see what is actually causing it. Perhaps we are taking some drugs or some medications or some alcohol or anything that is actually affecting us. Or perhaps it is access to healthcare that is causing this. That is our biggest challenge in the district. And if all stakeholders will come on board to help us to cry out and let us educate the public that we don't want to lose the babies that should be our future leaders. So perinatal deaths is our challenge in the district. And that is my most pressing need. If anybody can come to our aid in terms of logistics, in terms of infrastructure, in terms of equipment, I'll be more than grateful.
DC Catherine Lankono pledged to work with the Nadowli-Kaleo District Health Directorate to put a lid on the rising cases. Some of the women expressed joy and thanked the Nadowli-Kaleo District Assembly for handing over the project, stating that it will go a long way to reduce their burden. Reporting Kogwe News, Rafik Salam, Ombokaha.